go. Hi, everybody. I am Becca Davis, Executive Director of the Coalition for Home Repair. I know most of you, but I think there are a few faces new to me, so just wanted to put my introduction out there. I'm really glad you decided to attend this webinar today. We have a lot of really interesting information to share with you. I'm going to go through just a brief history of the background of this project, why we're doing it, what we hope to accomplish, what our goals are. I'll talk a little bit about the timeline of it and what the actual survey tool looks like that we're using. We have a new partnership agreement that will ask those who are participating to commit to, and so I'll review that, and then finally we'll talk about the new funding incentive that we have, which we're really excited about. Let's see here. Too many tabs open. Here we go. Hopefully y'all can see that okay. So this all started with our Healthy Homes Affinity group that has been around for a few years, I guess about 3 now. And that group launched back in 2019. So we've had about 15 meetings over the last 3 years. And we do have an archive of recordings of all those meetings if anybody is interested in reviewing all that. But basically the goals of the group were to, and still are, to share information related to health outcomes of home repairs so that we can replicate successes that our members are having in multiple communities. We want to get more funding for that. We want to share information about how to partner with healthcare providers. Sorry, my screen's going wonky here. Let's see if I can fix this. And encourage each other, kind of a support group. And also we don't just consider physical health outcomes, but we also think it's really important to include mental health outcomes in everything that we do. And Robin Renner, who's here with us today, she facilitates the group with me. And Robin, if you don't know her, she's an individual member of the coalition. She's worked for a Rebuilding Together affiliate, or a Habitat affiliate, also with Yachad, which is an independent home repair nonprofit near DC. And Robin just has a ton of experience with construction, healthy homes, and I'm just really glad that she is with us on this journey, helping us out. And so through our Healthy Homes Affinity group, we've learned about all the different healthcare partnerships that our members have been forming. And one in particular really stood out to our group. And so I just wanted to highlight that real quick because it did inspire a lot of this project. So Dawn Taylor is the founder of Chesapeake Housing Mission, one of our coalition members, and they had a great partnership with a hospital system up in Maryland where they are. And published a really wonderful report that has information about all the healthcare outcomes of their repairs. And it's really impressive. I think the number that stood out to me the most was about a 95% reduction in falls after they did repairs. And then also the actual cost savings. They were able to verify their numbers with the hospital and found that, for the about $88,000 worth of repairs that they spent, they saved $186,000 in healthcare costs. So it's more than 100% return on investment, which was really, really cool, more than double. And so a number of other members of ours were interested in these findings, have asked for Dawn's survey tool, have been started to replicate it. And we decided that we wanted to take this on as a project of the coalition as well. So I think it was back in last November, shortly after our Reframe conference, that our Healthy Homes Affinity group was talking about the plenary that we had on lean impact. And the idea was that a lot of times when you're trying to start a new project, you spend a long time planning, making sure you get everything exactly right. And it takes a really long time to launch and maybe starts too big. And so the idea of lean impact is that you start quickly and you start small. And so we did that earlier this year. We quickly put together a survey tool, found some folks to help us to commit to analyzing the data. And we actually have some members who've already started collecting this. And then in the next few months, I worked really closely with Jesse Abraham and Louis Tenenbaum. They're with the Homes Renewed Coalition. Robin connected us with them, and they're great partners with us in this. And then also with Beth O'Connell from East Tennessee State University's College of Public Health. She's here, and Beth also supports ASP's Healthy Homes work as well. And so we work together with Robin, and also Greg Wayne with Hope Builders, one of our members, really helped us out in finalizing our survey tool and putting it into a spreadsheet that we could use as a template. And so we do have some members that have already been using that, which is great. And then we also started seeking funding. We asked for a substantial amount of money from Lowe's that unfortunately we did not get, but we went back and asked for a smaller amount. We were successful. And so just a few weeks ago, we got $35,000 in gift cards from Lowe's to support this effort. And so once we did get funding, we wanted to make sure to open this up to all members of the coalition and not just to those who had been part of the Healthy Homes Affinity group. So we are going to continue meeting as a Healthy Homes Affinity group to talk in general about health outcomes and hospital partnerships and things. We're forming a separate new cohort just for this falls prevention data demonstration project. And just a quick note on the difference between our affinity groups and our cohorts. Our affinity groups are open to any member to join anytime, whenever they want. You don't need to sign up, you can just show up. They're pretty informal, often a round table style. And then our cohorts usually involve either an outside trainer or a grant or some funding. And so there's a firm commitment to participate, whether it's a certain number of meetings or other things such as this one, which will be some research. So we're really excited to launch this new cohort, and sometimes our affinity groups turn into cohorts and vice versa. In this case, we'll have a few running alongside of each other. We also have our aging in place cohort. So there's a lot of things happening right now related to health and outcomes for older adults. All right, let's see here. Before we get too much further, I really want to thank Lowe's for providing this funding, Beth and ETSU and Homes Renewed Coalition, and also Robin for all of their work on this with me. This project is really only possible because of all of their support. So a bit more about the goals for the project. We talked about a few different things that we could research. We could have looked at indoor air quality and asthma and that kind of thing. We may do that in the future, but we felt like the falls prevention was a really great place to start because it's so concrete. And we had a great example of a member who'd done good research on this before. So our goal for this new project is to collect data nationwide that shows a significant reduction in falls after repairing and modifying homes for older adults and those with disabilities. And we also hope to show the medical cost savings for that as well. So as I mentioned, we're partnering with the Homes Renewed Resource Center, ETSU, then they will help us with our data analysis. And we are not paying them for that. So we are especially grateful for their commitment to this project. And so the coalition is going to be collecting data from our coalition members about homes modified and certain metrics related to that. And we'll be aggregating all that together, sharing it with our research partners, and hopefully coming up with some great reports and statistics that will show the value of home modification, how it reduced health costs, how it improves life and dignity. And we'll be sharing the data with all of the members that are participating as well. And so, as you all know, the coalition supports a nationwide network of nonprofits that make homes safer and healthier, and that includes things like installing safety equipment to prevent falls, and assisting the daily activities for older adults or people living with disabilities, like accessibility ramps, grab bars, handheld showers, all sorts of things like that. And so those measures can reduce future hospitalizations and emergency room visits, and therefore the associated medical costs, even things like physical therapy, that would be needed to regain mobility after a fall. And so a lot of healthcare systems are finding that it's actually more affordable to invest in home repairs and modifications than to cover the cost of the needed healthcare. And so overall, the purchase and installation costs of all these safety devices and measures has been difficult to justify for nonprofits and their funders because there hasn't been a lot of proof of the efficacy that it reduces the medical costs. And so that's what we're trying to do, is create more proof of that. And so by doing this project, we hope to show that there is a significant savings, and that will encourage insurance, healthcare insurance providers, healthcare systems, foundations, and other funders to fund our members individually, to fund the coalition collectively, to give us more funding that we can pass through to our members, and of course, ultimately to make more quality repairs for homeowners. If we can find specific repairs that make a greater difference in reducing falls, we can encourage more organizations to focus on those repairs. So we really hope that this will benefit everybody at both the local and the national level. And it could even result in some great advocacy work as well. The Homes Renewed Coalition actually has a bill right now that's being introduced in Congress. We'll talk about that some other time, but so we have developed a data collection protocol and tool to track the home repairs and the outcomes. And our coalition will be managing that database, and we'll be sharing that information with our research partners, and just trying to get this project moving as quickly as we can. Let's see, before I get any further, Beth, do you want to say anything? Or Jesse? Jesse's here with the Homes Renewed Coalition. Do either of you want to add anything?
I don't have anything to add, thank you. You covered it well. We're happy to contribute as we can to the great work that all the coalition members are doing.
Thanks.
I agree. I'm happy to be a part of this project, and hopefully can be a part of it being useful to folks across the country.
Thanks. Robin, am I forgetting anything? You want to add anything?
Thanks, Becca. Yeah, I just want to say that this idea came out of the fact that we are a coalition of very small nonprofits, a lot of the small nonprofits here at the coalition. And gathering that kind of data so that you can show the metrics to your funders is difficult. And when we aggregate this data across the nation and across all the smaller nonprofits, we really are going to have a very powerful tool that you'll be able to use individually to show your funders the work that you're doing and things along that line. Right now, there's nobody who is really gathering this data in small rural areas or from small nonprofits. And the fact that we're gathering this as a unified group of data is just amazing. I also wanted to add that another cost savings that the Chesapeake Housing Partners didn't mention is the being able to transfer generational wealth. As we all know, that when somebody is forced to go into assisted living for Medicare to pay for that, often they have to give up their home and take their wealth down, and that then means it doesn't get passed on the generations. And a lot of families and cultures, the house is the wealth, and when that is taken away because of an aged family member who has to go into assisted living, that is difficult. And so avoiding that for as long as possible is really important. So between the metrics and being able to help people keep the wealth of their home, this is incredibly important data that we're gathering.
Definitely. Thanks, Robin. So let's dive into some of the details. I want to look at the project timeline first. With the funding that we have right now, we will be able to distribute at least a $1,000 Lowe's gift card to any organization who can commit to repairing or modifying at least 15 homes that has a resident age 62 or older, or someone living with disabilities by the end of this year. So there's a pre-survey to be done, and then you do the repairs, let us know what repairs were done, and then there's a 6-month post-survey and a 12-month post-survey. And so the goal is to have all of the repairs or modifications done by the end of this year, and then 6 months after, whenever it's done, to do that post-survey, and then 12 months after. So the very latest that it would be finished would be the end of next December. And we'll give you a 1-month grace period to submit your data to us. So if you're finishing up home repair through the very end of December, we would want that data by January 31st, 2023. Gosh, that sounds so far away, but it's really not. And so that's the timeline that we are looking at. I wanted to mention that it does not have to be a full rehab or renovation of the whole home. You could choose to just do a grab bar blitz and just install grab bars in the bathroom, and then ask the pre-survey questions and ask the 6-month and 12-month post-survey questions. So it could be a very small project. You could have one person installing a bunch of grab bars in 15 homes, or it could be a very large project where you're doing, ramps and all sorts of other modifications as well. I like the idea of having some folks doing just the grab bars, because I think that would give us a good control group and we could compare possibly the outcome differences between just grab bars and other modifications. We'll be tracking what sorts of repairs are done. That way, hopefully we can see which interventions make the biggest difference. So that is the timeline for the project. And then for the survey tool, as I mentioned, there's a pre-survey that you ask before you start the work. Usually when you do the initial home visit, then you actually complete the work. And then there's a 6 and 12-month post-survey. And so there's 7 basic questions that we are asking everyone who's getting homes repaired through this project. And these are the same questions you'd ask before you repair the home, 6 months after, and 12 months after. So we're asking how many times a resident has fallen inside of the home in the last 6 months, how many times they've fallen while entering or exiting the home in that same time period, how many times have they received emergency services in their home, so having an ambulance called, for example, or how many times have they sought care at an ER, how many times have they been admitted to the ER, any unplanned visits to a medical facility besides a hospital, and then occupational or physical therapy. So it's a lot of questions. And I recognize that for some of you, you may decide that that's too many. You already have a bunch of questions to ask, and that's okay if you decide you can't do this. We did try to pare it down to as few as we could. Believe it or not, we actually started with a much, much bigger list than this and pared it down to what we felt was the bare minimum of what we needed. Let's see, I am gonna switch to actually showing you the survey tool here. So just give me a second to change my screen sharing here. Almost there. I think this is it. There we go. Great. So we have a spreadsheet. It's a Google spreadsheet, excuse me, or you could use it as an Excel spreadsheet. Basically, you would copy this Google spreadsheet for your organization or download it as an Excel file. The first tab is just to help you, remind you of when the 6 and 12-month follow-ups are due. You don't actually need to complete anything in here. It all auto-populates from the other tabs. And this is all thanks to the fine work of Greg Wayne of Hope Builders. So he put all that together. So basically there is a column for each project. So this could hold up to 21 projects, or you can certainly copy and add more of these beyond if you're doing more. There is some demographic information that we need. We do not want to know the name of the client. We do not want to know their address. The coalition does not want any of that information. We don't want anything that would identify someone. And so you'll be creating a unique project identifier. And oops, let me scroll back to here. It tells you how to create that. And then there are those 7 questions that I already mentioned that you'd be asking before the repairs are done. There's 2 notes on here. If you want to be able to confirm your data with a hospital in the future, you might want to collect your client's birth dates, because if they have a common name like John Davis, my husband, you need to know which John Davis and be able to track that by birth date. And then also it mentions that you may want to ask which hospital they were transported to if there's multiple in your area. But again, we don't want that data. That's just for your own purposes later.
Becca, we had a question. Somebody asked, what is the unique project identifier?
Okay.
I think that that's really up to the individual organization, how they wish to identify it. Is that correct?
We have a little code here. So we start with a 3 or 4 letter organization abbreviation. So for example, Chesapeake Housing Mission would be CHM. And then the 2-digit year, so 22, and then the month of the initial survey, so 01 if it was January, and then primary client initials, which could be 2 or 3 initials. Basically something that would help you as an organization go back and make sure that you're connecting the right data to us that you could follow up 6 and 12 months later.
And that's just a suggestion
Yes.
with the project identifier. That's nothing that goes into our survey.
Yeah, it would help us to have the organization code in there, I think, just so we can easily figure out which one it is. But if you're not comfortable using client initials and you want to use something else for the last few, that would be okay as well.
So question real quick, we we give each client a job number, so we could do SER and then their 4-digit job number or something would be.
Yep, that'd be great. Yep,
Okay,
as long as
perfect.
we can have the same identifier for your pre, your 6 month, and your 12 month, that you can connect it back to whoever it was. Yep, that's perfect. And then there's a tab for you to fill out what work you actually did on the project. We have it divided up into, I think there's 24 different categories, and it's just an X, basically. Did you complete it? Is it still needed? So you didn't complete it, or was it not needed for each project or for each home? And then to help us also figure out some of the dollar stuff, we would love your estimates of all these things. You don't need to spend a lot of time figuring out, but if you could estimate the total number of volunteer hours spent on the project, or nonprofit staff, if the nonprofit was completing it, if you had a carpenter on staff or something like that, or if you hired somebody to do it, how many hours they spent. If you paid a contractor, if you could let us know how much you spent, or the cost of building materials. This can all be estimates, it can be ballparks. We don't need anything exact. We don't want receipts or anything like that. This will help us just figure out how much was spent, so that later when we can figure out what the cost savings are, we can compare the two, like Don and his group did. And then the 6 and 12 month ones are very simple. It's those same 7 questions that we already had. And there's just one additional question about: have the abilities of the residents to see, hear, or get around the house have changed, worsened since the project was completed? So if somebody fell and broke their hip and is now immobile, obviously that would impact the results. So it's just a yes or no. And then the same question 12 months after. You don't need to go to the home physically. You can make a phone call and ask these questions. That's fine. We recognize that there may be cases when you can't reach somebody 6 or 12 months later, if they pass away, if they move, if their phone's disconnected. We understand that. So the goal is just, your best intention to get us data on 15 homes. If you're able to do more than 15 to help offset that, attrition that we know will probably happen, that would be super helpful. But if you start with 15 and end up only giving us 10 at the end because you just can't track down those last 5, that's okay. We will understand. Are there any other questions about the spreadsheet before I move on? Okay. Let's see, I'm gonna get back to my slides here. This will take just a second. The next thing I'm going to talk about is the partnership agreement. And this is basically the way to sign up to participate in the cohort. Because we've never done a research project like this, it sounds a little more like legalese than what we've done in the past. So I'm going to go through it section by section and make sure you all understand what we are sharing and why we're asking you to agree to it. And I'm almost there. There we go. And so all of this will be in a Google form, and the part you have to complete if you want to participate is very short, but all the preamble stuff is a lot longer. So the first part is about confidentiality, just that we will not collect the names or addresses, as I already mentioned. We'll have a general location, county, zip code, that kind of thing. We don't want to know people's medical diagnosis. We don't want anything, that's confidential or private like that. And that there's that unique identifier. Everybody should follow all the laws, all that good stuff. The second part is about the ownership of the data, that you as a coalition member would retain ownership of any data that you submit, and that the coalition would own the aggregated data that results from the project. And then the data release, that we would share all the data from this project with participants and our research partners in a timely manner. So we will share with you the aggregated data if you would like to play with it yourself. We will not release the data to anybody who's not officially a part of this project. So you have to sign on to this agreement to be able to access the data. you as your own individual organization, of course, can release your own data to anybody you want to, but you would not be allowed to give this aggregate data to anybody else who's outside of, this agreement and participation. Number 4 is about publication. So anybody participating won't publish it without approval from the coalition. And that's just that we want to make sure that anything comes out of this aligns with the purposes of our project. We're not going to wordsmith everything. We don't need to be a co-author on it. We do expect that our research partners will help us publish something. So I know Beth, in order to be able to participate, I think has to publish something from ETSU on this. But we would, be able to partner with her on that and see it before it gets released. Of course, coalition members, you're welcome to release your own findings or conclusions based on your own analysis of your own client's data, but we ask that you don't publish anything with the aggregate data without going through us first. We're not going to sell any publication from this. Once we have it, it would be free for the public. We would want to share it broadly. Nobody is supposed to financially benefit from this, except of course, we're hoping that we can all use the information to apply for grants. So only for nonprofit activities or advocacy that further supports the goals of the project. And then our project integrity, just that we're only going to use the data that we collect for this purpose to track falls, that were prevented, reduced, and the cost savings for that. There's an accuracy of data disclaimer and release of liability, saying that everybody will try to do their best to give correct data, but it's possible inadvertent errors may occur. The coalition or research partners, nobody takes responsibility for inaccurate data. We do not take liability for anything like that. And then for any third parties, we're working with Homes Renewed Resource Center, ETSU. We will have separate agreements with them that are similar to this. And then if there were any other third party to want access to the data, we would make them agree to these same things. Thanks for bearing with me. We're almost done, guys. I know it's a lot. And then duration, this just goes through the timeline of it, that this agreement would be in effect through the duration of the project. It has all the dates already mentioned on there. We will have cohort meetings, but attendance in those meetings is not required. It's just kind of a support group to help you if you have questions, that kind of thing. If any disagreements come up, as they can during collaborative projects, we would attempt to resolve them respectfully and work things out. If we really can't agree on things, then the coalition will determine how the project's conducted. If you decide you can't do that, you can back out, or we may ask you to step out. And you would still, of course, be held to the confidentiality and publishing clauses and all that kind of thing. And finally, the last one's about the funding. We have $35,000 to distribute to eligible coalition members who want to participate. We do require that you submit a 2022 impact report to us if you haven't yet. Most of you probably have, but that makes you eligible for all pass-through funding that we have. So up to 35 organizations who agree to submit data for 15 or more homes will get a $1,000 Lowe's gift card upon or shortly after completing this agreement. So you will get it up front, not at the end of submitting all the data. We want to get that money out there as soon as we can. And so you can use those gift cards for purchasing building materials, tools for the projects. You don't need to save receipts for us. There won't be any additional reporting for the gift cards. We will give you an opportunity to share photos with us, mostly so we could use them in reports or give them to Lowe's to thank them, but that won't be required. If you sign up to do this project and in the end something happens and you don't end up giving us data, we will be sad, of course. We won't charge you for $1,000, but you could be ineligible for getting any future pass-through funding from us. So that is what the agreement looks like. I'll give you a link to it at the end. Just a quick summary again of the requirements for funding. If you want the $1,000, you need to have already submitted your impact report. And if you haven't done that, it's not too late. And in fact, you get another Lowe's gift card for that. So go ahead and get that in if you haven't and get more money. You need to commit to completing 15 projects by the end of this year, and those projects should be focused on helping those who are 62 and older or someone living with a disability. You could do that grab bar blitz only if you'd like, and you need to be able to collect and submit the data to us by the deadlines. We have an initial deadline of completing this partnership agreement by June 30th. And let's see here. Let me find where my notes went for this page. Juggling too many things today. Here we go. I don't anticipate that we'll have more than 35 organizations sign up by the end of the month. We don't have 30 organizations on here today, but if for some reason that does happen, we would prioritize funding based on the first 3 bullet points here. So people who've already been participating in the project, we want to have a diversity of project locations and project types. And then also, we would also go by the date of who completed the agreement. So, you know, if we would go with everybody who signed up at the, earlier than June 30th. I don't think that'll happen. If we end up having fewer than 35 organizations sign up, which I think is actually likely, then we will use these priorities to decide who gets additional funding, who might get $2,000 or $3,000 in gift cards, especially if you can commit to collecting data for more homes. So on the commitment form, it'll ask how many homes do you think you can do by the end of December? And if you say 30, that will give you a greater chance of getting $2,000, or if you say 45, then $3,000, that kind of thing. I also wanted to acknowledge that we know that $1,000 is not a large incentive for this project, and probably you are not here because of that funding. We recognize $1,000 is not going to fund all of the repairs or even just the materials needed. And so just wanted to put that out there. I think, though, that it is a project worth doing in its own right, even if there was no funding. I imagine that's why most of you are here today. And the funding is kind of just an added perk that we have. We know that building materials are expensive and getting more so, it seems. And so we wanted to be able to provide a perk and incentive for it. So we're really glad to be able to do that. But again, recognize that $1,000 is not a lot in the grand scheme of what the cost of repairs actually are. And so I will drop some links in the chat box for you. One is the link to this agreement form if you decide you want to sign up. I'll also share, what happened here? Sorry. There we go. I'll also share the link to Chesapeake Housing Mission's report on all of their work, because it's really interesting. You might like to see what sort of things you could come up with for your organization if you follow through with this project. And I'm going to stop sharing my screen here so I can get you those links. And now we will just open it up for questions. What would you all like to ask about or comment in general? Anything you want to share or say? Is there anybody here who has already started using these questions? We have some folks in our Healthy Homes Affinity group who've already started. Is anybody here heard of that yet?
We've started, obviously.
Yeah, that's right. Jeff, do you mind sharing real briefly on how it's gone, asking the questions your clients? Have you found it to take a lot more time or effort?
Not at all. It's a pretty seamless process because we were doing the intake anyway. And so adding those questions, some of which we asked to some degree anyway. So no, it hasn't been a burden at all. So it's gone real well.
Great.
Jeff, a question for you. Do you anticipate doing your follow-up like 6 months, 12 months in person or on the phone or combination of both?
No, those are probably going to be our intake folks, and they'll probably do them by phone. I don't think we'll be going back into the homes for the most part.
Okay, great. Thank you.
Great question. I'm also going to put a link here to the spreadsheet of where we actually collect the data and see a few questions in the chat box. Is it permissible to collect this data in relation to other programs you're already operating? Yes, absolutely. You're welcome to ask as many other questions or things as you want to. We just only need the data that's on the spreadsheet. That's great if you're already asking those questions. And yes, I can share the slides, Ellie, absolutely, with my notes and everything. And the last link I just put in there is a link to the data template spreadsheet. What other questions y'all have?
I just wanted to comment. I think you hit the nail on the head. I think the data here for everybody is more important than the lowest gift card. We do appreciate it, though. We appreciate everything you're doing. I think it'll just be huge to have that data nationwide instead of just the 100 homes we do a year. You know, it'll be very impactful, and great for funders in the future.
Yeah, absolutely. And you can ask these questions of all homeowners. You don't have to just limit it to 62 and older or people with disabilities. If it's easier for your process, just to ask everybody, you can do that. Just, we know that that's most likely where the falls are going to happen. So that's what we would like to see for the 15 projects.
Sure.
And of course, we would hope that you would be able to continue asking these questions into 2023, and we will be applying for more funding for this. So if this timing doesn't work for you, if it's maybe too soon for you to ask these questions, I would encourage you to consider starting it, even if it's later than that, and participating whatever point it works for your organization. Because hopefully we will have more funding in the future, or even if there's not funding, just, you know, the opportunity to be asking the same questions that a bunch of other organizations are asking to get that aggregate data and reporting, I think is really the most important thing.
And then one more, it's a question for anybody that can answer it. In all the links that are in the chat, how do you save those for when the Zoom
I will send a follow-up email with them.
Okay.
I think, yeah, usually if I'm on somebody else's Zoom, I just click on it and pull it up in a web browser or something and have it for later, but I will make sure you guys get the follow-up.
Okay. That's what I was doing, but I didn't know if there was a way to save them all.
I think you might be able to save the chat somehow.
Okay. If we're getting a follow-up email, that'll be fine.
I will send it to you for sure.
Perfect. That's all I had. Thank you.
Great. Anybody else have questions or comments?
I'd just say I also agree. I think this is awesome, Becca, and I'm excited about the data that we can collectively collect. So thanks for leading.
Yeah, sure. We're excited to see how many folks sign up for this and what we get out of it. I will add that the self-reported stuff is technically part one of a bigger project. If you really want to take it to the next level, you would need to have that hospital partnership and have them verify the data. We know that it's easy for people to forget or misremember. And so there is a lot of value in the self-reported data, but what Don was able to do is give the hospital system his results, his information, and they cannot, of course, tell you the cost savings of any individual person because that would violate HIPAA. But what they could do is look at the total group and say, oh, you gave us, I forget how many it was, maybe you gave them data on 50 individuals, and they were able to identify 44 of those in the system and came back and said, you know, the cost savings for this group of 44 people from the 6 months before you repaired the home and the 6 months after was $186,000. And so by being able to verify that with the hospital, then you can, you know, have more definite data. But even without that, we can use some average cost savings of, you know, what does a fall typically cost for somebody who needs to go to the emergency room. And so we can apply some of that generic data nationwide to whatever you have. So we won't have to have that hospital data to have a report, but ultimately for your own individual purpose, if you're able to form that hospital partnership, I think that could be really valuable. I mentioned our Healthy Homes Affinity group is separate from this and they're continuing to meet. We do have a meeting on July 11th, which is focused specifically on those hospital partnerships and how to start them, who to talk to in the hospital, what your talking points should be, that kind of thing. So if you're interested in that part of it, you can sign up on our website right now for that affinity group meeting. We will, as I mentioned, have some optional cohort meetings for this group. The dates I have somewhere here. It'll just probably be a half-an-hour check-in meeting. I'll include this in the email as well, but it'll be July 21st, August 25th, and September 22nd at 1 o'clock Eastern. And the idea of that is just to answer any questions you have, see how people are doing. You don't have to show up. We'll record it and send it out to you along with the notes if you can't make it, but just as a way to support each other as we go through this, to have some opportunities to connect. So the only requirements to participate is to sign the agreement and then start collecting the data and submit it to us at those 3 different intervals. There's no meeting requirement. Any other questions or comments? Robin? Yeah.
Yeah. Just want to remind folks that, you know, if you've already have some people that are in your pipeline already, but you haven't actually been able to schedule the work, it's okay to make a little follow-up phone call to do that. You don't have to have, from that point that you start with us, you don't have to start with the people that are first getting into the system. You can kind of backtrack a little bit if you need to.
Yeah, that's true. If you've already done the initial home visit and didn't ask, but you haven't started the work yet, there's still time to ask those pre-work questions.
That'll help you, because I know sometimes the small nonprofits getting to 15, we had a big debate on how many projects is realistic for particularly some of the small nonprofits. But I just want to make a comment that there isn't a hard stop or a hard start date for your collecting of the data, as long as you kind of get it in before the work actually starts.
Definitely. And if 15 is too many for you, but you'd still like to participate, go ahead and fill out the form anyway. We may still have enough gift cards that if you can do 5 or 10, we may be able to have some support for that as well. And even if we don't, you could still participate in the data project and get your numbers in there in the reports and all that kind of thing. So it's still worth doing, even if you can't do 15. Any number is good to start with. Do a pilot of a pilot project, basically. Anybody else? Questions, comments? Well, thank you all so much for your interest. I'll follow up this afternoon with an email with all sorts of information. And I'm happy to talk to people individually as well if you have specific questions about how this would work for your organization. But I'm super excited to get started. So thank you all so much.
Thank you, Becca.
Thank you, Becca.
All right, bye everybody.
Thank you.
Good afternoon.
Bye.